Hello and welcome. Today we have Dr. Aditya Shah, who is a successful medical resident and a clinical fellow in a prestigious institution in Midwest. He is a power to reckon with. He is not only an excellent clinician and researcher, but a big deal on social media. So those who have not followed him yet, follow his Twitter handle IDDocAdi, and he's famous for his antibiotic stewardship through hashtag steward meme. The question for you we have for you today we have Dr. Shah is that um, everybody as an IMG, especially
hmm
when you go through the application process, sometimes things don't seem to go your way. You might not be
hmm
getting interviews or observerships. So what did you come across these things, and if you did, what you did to cope up with, or what
hmm
suggestions you have for our learners?
Okay. Thank you, Dr. Kashyap, for having me. As an international medical graduate, you're right. You do face several moments where you feel low on confidence and a sense of what will happen or what will not happen. Let me tell you one thing, that feeling will never go away in your entire career, at least for me so far. Because if you match into med school, you'll be like, what if I don't match into residency? Once you're in residency, you'll be like, what if I don't match into fellowship? And when you're in fellowship, you'll be like, what if I don't get a job? So this feeling is never going to go away. What I would recommend, or what has worked for me, is focusing on the journey rather than looking at focusing on a particular result. Focus on the process and learn from the process, because at the end of the day, we go into medicine to help patients, right? So if you're learning something with the right intention of eventually helping a patient, that is how I look at it, in the sense that don't look at a particular goal, just focus on the process. Stay in touch with other applicants who are in the same journey as yourself, whether that be other juniors or seniors from your medical school. Stay in touch with your family, which was obviously a big support and a motivation for me. Also, tell yourself that whether this happens this year or next year or the year after, if you are persistent, I seldom know anybody who has not matched into residency in the US. It might take 1 year, 2 years, or 3 years, but it's just about getting that one toehold into the system. Once you're in, the US medical system is extremely fair, and it respects merit a lot. And if you are doing stuff with the right intention, work hard, be honest, and keep the goal of helping the patients. Stay in touch with your family and your friends, and focusing on the process, and just waiting for the tough times to go, because as they say, change happens for the best, and this too shall pass. So that's how I've looked at it. And being a clinical fellow who's completing his training right now, I still have the same feeling that you're mentioning as an IMG who's applying to residency. I'm not sure if this sounds too much of gibberish to you, but that is essentially my philosophy of life.
So this shall too pass. That is
Yes,
very, very
exactly.
profound, and we really appreciate you sharing those tips with our USMLE aspirants or future residency and fellowship applicants. We would like to thank you as well. For those who have missed the initial part, please do follow Dr. Adi Shah on Twitter at IDDocAdi now, and antibiotic stewardship on Steward meme as well. And don't forget to like and subscribe to our channel. That's the only way you'll get alerted to these excellent talks and videos we're recording. And we'll come back with more interviews with Dr. Shah, especially about social media, how you can use it for your application or beyond. So stay tuned and do subscribe to our channel. Thank you, Dr. Shah, again.
Thank you, Dr. Kashyap, and good luck, everybody.